Assalamualaikum and hello again everyone. So we shall continue with the last part of our nutrition or diet and health topic. Okay, so this is the last part of the topic on diet and health or nutrition and health. We have previously talked about the energy balance. Okay, so what happens if we actually take overconsumption of nutrients? Okay, if we take the less consumption of nutrition, we will be undernutrition. Okay, or we call it malnutrition. Okay, but if we are actually consuming over the nutrient, that means we will become overweight or obese. So the cause of the obese is overeating, or can also be poor nutrition intake. It can also be genetic factors and low physical activity. But like we have mentioned in the second part, where the energy balance, we should maintain the energy balance between the consumption and also the expenditure. Okay, so what happens to our body if we are overweight or obese? The after effect of that, we will have cardiovascular disease or heart attack. We can also have develop cancer or type 2 diabetes, and can also have brain stroke. Okay, so what do we do about it? Okay, then we can either take nutritional diet or increase the physical activities. Okay, so to assess or assessing weight and also health risk, there are few components, okay, for assessing the weight and also health risk. It involves using 3 key measures. Okay, one of it is the body mass index. Number 2 is the weight circumference. Number 3 is the risk factor for disease and conditions associated with obesity. Okay, then we go first to the BMI or body mass index. As we all know that BMI is a very useful measure of overweight and obesity. Okay, it has the calculation of the BMI. Okay, it is calculated from your height and also your weight. Okay, so it is an estimate of body fat and a good indicator or a good gauge of our risk for disease that can occur with more body fat. Okay, so the higher the BMI, the higher the risk for certain disease, for example, CVD, cardiovascular disease, high blood pressure, type 2 diabetes, gallstone, breathing problem, and certain types of cancer. Okay, so if you see from this figure here, this is the mortality ratio from 0 to 2.5. This is the body mass index from 0 to 45. As you see from the curve, so the one with the pentagon shape is the men, and the square shape, like a diamond shape, is the women. Okay, so if we have our BMI at about 20 to 25, so we are considered a very low risk level of mortality. That means we are having very low risk of getting the disease. Okay, if we have the body mass index is about 25 to 30, we are still considered low of getting risk level. Okay, but it's actually different from men to women. You see this point, the color, the purple color and the yellow color. Okay, so if you see here, the level is about 1 for women. As it goes along, for men, it's already increased to 1.1, for example. Okay, and as the body mass index increase, you can see that the curve becomes higher and higher risk of getting the disease, the CVD, the diabetes, pulmonary disease, and etc. Okay, the figure indicates the level of risk with each 5 unit increase in BMI, so 20, 25, 30, 35, 40, and 45. The lowest risk, health risk category occurs for individual between 20 to 25. So it is best to maintain our BMI to be around this 20 to 25. Whereas at higher risk category includes individual whose BMI exceed 40. So you see that's this rate indicator. So mortality ratio is very high. For women, the desirable BMI range between 21.3, okay, so this one, and 22.1. So the mortality ratio is about 1. The corresponding desirable range for men is about 21.9 to 22.4. Similar, this one, okay. So increased incidence of high blood pressure, obesity, diabetes, and coronary heart disease will occur when the BMI exceeds 227.3 for women, somewhere here, and for men is 27.8. Okay, so you can go to this University of Michigan website in order to read further about this diagram. Okay. Although BMI can be used for most men and women, it does have some limit, okay, because it may overestimate body fat in athletes and others who have muscular build. Because we use this as a body weight. For people who has muscular build, of course, their mass is bigger or higher, right? The berat, the mass of that individual person is higher. So BMI may be underestimate body fat in older person and others who also have lost their muscle. Okay, so this is the calculation for BMI. You take your weight in kilograms, you divide by height times of height in meter, okay, or in meter square. So if you have this range, you are considered normal. If you are touching 25, you are considered overweight. So if you are 30, you are considered obese. Okay, so this is the picture. This is the one that I have mentioned earlier, like the color coding for the Singapore healthier food choice range. They do it like this. Okay, back to this one, body mass index. If you are at the green color, green zone, we are considered okay. Okay, so the level is about 24.9. Okay, so if we reach somewhere here, we should take note that we have to reduce our weight, okay, to the middle range, right? So this is adapted from WHO in 1995 and 2004. For those who are, I think, underweight, there are several measures for underweight: severe thinness, moderate thinness, and also mild thinness. Okay, for the normal range is about 18.5 to 24.99. If it touches 25, it is already considered overweight. Okay, pre-obese. Okay, so for obese, it has 3 classes: class 1, class 2, and class 3. So at 30 to 34.99, it is considered obese at class 1. For 35 to 39.99 is considered obese class 2. Anything above 40 is obese class 3. And that is the one that has the highest risk of disease. Okay. The other one, after BMI, we should also consider the waist circumference. Circumference is the measurement of the round around your waist. Okay, so waist circumference is measured at the level of umbilicus to the nearest about 0.5 cm. The subject stands erect with relaxed abdominal muscle. So you should, when you want to measure this, you should be able to stand with relaxed muscle, arms at the side and feet together. So the measurement should be taken at the end of the normal expiration. So this waist circumference, it predicts mortality better than any other anthropometric measurement. The first slide, we have seen this, the physical measurement, right? So this one can predict the mortality better. Okay, for males and female, they have divided into two levels. Level 1, if it's more than 94 cm, and level 2 if more than 102 cm. For female, level 1 is more than 80 cm, level 2 is more than 88 cm. Okay. So what is level 1 and 2? Level 1 is the maximum acceptable waist circumference irrespective of the age, and there should be no further weight gain. So for example, if you take this measurement tape and if you measure your waist circumference at level 1, if you get around 80 cm, so that means that is the maximum acceptable waist circumference, regardless what is your age, and you shouldn't gain more weight. Okay, level 2, so if you have anything above 88.88 cm, it means that you are already considered obese and require weight management to reduce the risk of type 2 diabetes and cardiovascular complications. Okay. So the other one is body composition. Okay, body composition is the distribution of body compartment as part of the total weight. For example, it's taking into consideration what is the fat mass versus fat-free mass. Okay, so fat mass, body water, excess mineral, and also protein should also be considered. Most concerned with metabolically active tissue and fluid status. Okay, this one is a body composition. So how to measure? So the body composition, normally they measure using some tools on the skin fold measurement. This one is used for assessing percent of body fat with a skin fold caliper. Okay, so where to measure? So this is the picture of where to measure. Okay, you can measure on the tricep, on the subscapular, on the lower back, on the chest, on the bicep, on the mid-axillary, on the abdominal, on the suprailiac, on the thigh, and on the calf. Okay, so you can see this picture. So this is like a typical skin fold measurement using caliper. Okay, this one is using a instrument. Okay, we call it bioelectric impedance analysis, or BIA. It is based on the conductivity or conduction of electrical current through fat and bone. Okay, this one can also be used. Another one is hydrodensitometry. This is underwater weighing and more accurate and less available. Not every, I think they use this in the United States, or more in Australia, for example. They might have this. I'm not sure if they have this in Malaysia. The other one is DEXA. DEXA is a body scan machine. It is the most accurate. Okay, so this one is it's actually like a MRI machine. You sit on this machine bed, and the machine will scan your body. Okay, for example, this is the image. This one is taken from this UC Davis sports medicine unit. Okay, so for example, this lady, okay, this is her body scan image. Okay, so if there are actually yellow color, those are the fat mass. The one in the red color is the lean mass, and then the bones are the blue color. Okay, So this lady has the BMI of less than 20, which is considered normal. So this is the DXA body composition. Okay, so the body fat is about 20%, which is about 21.7%, which is considered very healthy. Okay, and then the fat mass index is about 4.8 kilograms over meter square, which is considered normal or mild fat deficit. And visceral adipose tissue is very good, which is at normal risk. So you can see that this is the progress in January, in April, and in June. The FMI, the fat mass index in January is getting lesser and lesser. So this person is an athlete, I think. Yeah. Okay. So obese. Obesity refers to the overfat condition that accompanies comorbidity. Comorbidity meaning that if you have one disease which accompany with another disease. Okay, that include one or all of the following components, which is known as the metabolic syndrome. So kalau kita obese, if you're obese, then this metabolic syndrome will come, not just one, but 2 and 3 and 4 and more. Okay. Excess body fat, not necessarily body weight per se, will explain the relationship between the above average body weight and disease risk. So if your BMI is considered normal, but you have other body fat composition or body fat index is higher, that means you are not too healthy, although your BMI is considered normal. Okay, but there can be like indicator. All right. So the excess body fat, which is not the excess of body weight per se, can explain the relationship between the above average body weight and also disease risk, which emphasize the importance of distinguishing the composition of excess body weight to determine and if the overweight person is at disease risk. Okay, likewise, many individuals, they are not overfat or they are not too fat, but they may still exhibit obese correlates. That means dia boleh, the person can still considered pre-obese or obese, if they are not overfat. Okay. So this metabolic syndrome includes glucose intolerance, insulin resistant. Insulin resistant will lead to type 2 diabetes. Okay. And dyslipidemia, you have to consider the triglycerides, the LDL cholesterol, and the HDL cholesterol. So if your HDL cholesterol is low, your LDL cholesterol is high, and total triglyceride is high, that means you are suffering from dyslipidemia. Okay, and also hypertension. Hypertension is also considered one of the metabolic syndrome. Increased coronary disease, increased coronary heart disease risk, and increased visceral and adipose tissue, which can also increase the cancer risk. So this is all considered as metabolic syndrome. Okay, so as a summary, there are 6 classes of nutrient, and the intake of this nutrient, we should follow the recommended nutrient intake. Okay. There are many factors which will affect our food choice. The BMI, body mass index, waist circumference, body composition should be taken into consideration when one needs to assess the weight and also health risk. Okay. Overconsumption of nutrient will lead to many health complications. Obesity accompanies comorbidity and various metabolic syndrome. So we don't want that to happen to us. Yeah, there are many tips that can be followed to maintain healthy lifestyle and also longevity in life. Okay, so to end this diet and health or nutrition and health, I have laid out a few tips for a happy and healthier life. Okay, this is also yeah, of course there are many tips that you can use which suits you very well. This is part of the major ones that we can actually apply in our daily life. One is consider the healthy diet, okay, and then to regular exercise. Okay, this one is will balance out our energy, right? And then to get the sufficient sleep, and of course, everybody will have to face the stress. Is how we manage the stress level. Okay. The other one is to maintain healthy emotion and also spiritual. Okay. This one also talking about how we should have a good relationship with human or people around us. So we should keep company with good people. That makes our life happy and also healthy, right? And then when we have negative thoughts, and we should put it down at a very low level, and then we try as much as possible to stay optimist. Okay, this one is being taught by many health practitioners. Is we have to control our breathing. So if you're familiar with the yoga breathing technique, we can apply that also, no? Like a very long and pause of the breathing, no? Like you hold the breath and you release it slowly. That can also makes us less anxiety. This one can help people feel much better. Okay, and then the other one is we should spend time with the nature as much as possible. Okay. With that, I thank you very much for your attention. And this is the reference that I have used for the slides. You can go through and read through these and have further readings for this reference. Okay. So this is me. I would like to acknowledge Dr. Hafiz and Dr. Hasmida from the Department of Food Science for providing some materials for the module. Okay, with that, I see you in the next module. And if you don't understand or if you want to ask about the assignment, please drop an email or WhatsApp, and I will try to help as much as possible. Okay, take care.